sometimes we may have to take less than a full loaf.
Less than a full loaf? Does Clinton's call for compromise undermine President Obama's plan for reform? Joining us now, a guy who knows how Clinton operates better than anyone, Dick Morris, author of the big bestseller Catastrophe. And what do you make of what happened last night at this Nut Roots convention, whatever you want to call it, Dick? Because the booing from the gay activists wasn't all that surprising to me, given what the tension about Prop 8 and so forth. But was it something unexpected for him?
Yeah, well, the thing I mainly want to focus on is the healthcare thing. That half a loaf line, I can't help but go into a little history. In September of 1994, early in this month, like the first day or two, I spoke to Hillary by phone after the Moynihan Committee refused to report out Clinton's healthcare bill. And I said, compromise, go for the Dole bill, that was essentially what later became Kennedy-Kassenbaum. And Hillary said, no, you don't understand, Dick, we can't change part of the system and leave the rest unchanged. It'll just get worse. You have to do all of the change or don't monkey with it. And I said, Hillary, I feel like I'm talking to a communist. So I don't know.
She didn't want to compromise. You would advise compromise.
But listen, I just want to say this about compromising, and you can get all the facts about this in my book, Catastrophe. It's why I wrote it. The compromises they are talking about are irrelevant to the reasons that the elderly oppose this bill. What they're going to do in the compromise is conceivably rein in the idea of a public health insurance company so that it doesn't put the private companies out of business. I'm glad they might do that. It's a bad thing just to have a public company. But public or private is still going to be subject to the same government-imposed rationing. And the other thing they'll do is probably increase the cuts and decrease the amount added to the deficit. That'll actually hurt the elderly because the cuts are going to come out of Medicare. The fundamental problem with this bill that exists in any of the compromises is that you're trying to treat too many people with too few doctors. And the result is a cut in the reimbursement rate to doctors, fewer doctors, less medical care, and what it essentially is a transfer of medical care from the elderly under Medicare to immigrants who are now uncovered under the health insurance program that Obama is proposing. And I don't begrudge the immigrants the care, but I absolutely do not believe that the 12% of the population that's elderly should absorb 40% of the health care cuts. And you know, when I worked for that guy, Bill Clinton, we opposed those Medicare cuts.
I think you hit on something here, which is the common sense angle here, is that people just don't believe you can expand coverage to this extent. And as President Obama said today, we're going to make the whole system more efficient, cut costs, and yet somehow not be able to not have to ration care. That just doesn't make sense to people, especially when he's touting Medicare as a great shining example, and then he says, well, Medicare is not sustainable in its current form. Well, if it's not sustainable, fix Medicare.
When he says efficient and cut costs, what he means is QARY, Q-A-R-Y. It's a phrase everybody's going to know and hate if this bill passes. Quality adjusted remaining years. And what that means is you take the cost of a hip replacement or a bypass surgery. It's going to cost $100,000. You're 75, you're diabetic, you have high blood pressure, you have 3 more quality years left to you. In fact, you're a little bit demented, maybe you'll only have 2 years left to you. I'm not going to pay $50,000 or $30,000 a year for this. Denied. You're 50 years old, 40 years old, I'll approve the operation for you. That's what he means when he says cut cost and increase efficiency. That's decoding Barack Obama. I have a whole chapter in Catastrophe where I say what Obama says and what he really means to decode that vocabulary.
Dick, we have about 30 seconds up against a hard break, but do you think the rebranding that they are attempting is working? Did it work today?
No, absolutely not. What he's trying to do is to make the insurance companies and the special interests the villains, when the insurance companies, the drug companies, and all of the various vendors are all lined up in support of the plan because they've gotten their payoffs. There are no special interests opposing this plan. Yeah. Just a couple of 10 million mad elderly people.
Yeah, none of it makes sense, Dick. We appreciate it as always. And plenty more ahead as the factor moves along this evening. Sarah Palin becomes